Thank you and good evening. Thank you for attending tonight's event. My name is Ruth Price Rollins, and I am the president of the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I welcome you to our webinar, which is hosted by our Social Action Committee and our Physical and Mental Health Committee. We hope that this webinar provides you with information to make an informed decision for your health and the health of your loved ones. As a disclaimer, this webinar is intended to provide information that is based on fact and is as current as possible. We understand that information is rapidly evolving as it relates to COVID-19, and the Greater Cleveland chapter, the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated is not providing medical advice. We do encourage you to follow up with a healthcare professional and get further discussion so that you can make informed decisions. I will now introduce our guest moderator, Frank Wiley. Frank is an anchor for News Channel 5. He's been in the Cleveland area for 6 years. He's a graduate of Northeastern State University, a husband, and a father. He enjoys covering events in the community. So Frank, if you are now with us, I will turn it over to you to introduce our panelists. Good evening. Thank you for joining us. Everybody learned something.
Okay, can you hear me?
Yes.
All right. Mr. Wiley was having an emergency at his home. I believe he has the information. He is trying to call in, but we will move forward until he arrives. So I will do my best Frank Wiley impersonation until he is able to join us. Okay. So thank you all for joining in. I have the pleasure of introducing our panel, starting with Dr. Jackson T. Wright Jr. Dr. Wright is Emeritus Professor of Medicine at Case Western Reserve University and the former Program Director of the William T. Dames Medical Doctor Clinical Research Unit at University Hospitals Cleveland Medical Center. He received both his MD and PhD in pharmacology from the University of Pittsburgh and completed his internal medicine residency at the University of Michigan. An experienced clinical investigator, Dr. Wright's primary research interest has been the study of medications to treat high blood pressure and cholesterol, especially in Black populations. He has published extensively in the area with over 300 publications and served on many national and international advisory panels. Dr. Lynn Milliner is a pediatrician at Metro Health Hospitals and the medical director of the Cleveland Department of Public Health. She is a graduate of Case Western Reserve University School of Medicine, and she supports the COVID-19 hotline and is on the front lines daily, planning and implementing strategies to slow the spread of the virus. Dr. Shanina Knighton is faculty at Case Western Reserve University, where she works as a clinical nurse scientist, KL2 scholar, and part-time assistant professor in biomedical engineering. Her work focuses on infection prevention and control, including technology-based interventions to improve patient and hand hygiene, identification of harmful bacteria and viruses on patients' hands, and strategies for implementing infection prevention guidelines in different settings. And finally, Janine Boyd earned her graduate degree in speech and language pathology from Michigan State University. She served as a Cleveland Heights Council member and in 2015 became elected to the Ohio House of Representatives. As a state representative, she She currently serves as the ranking minority member to the Health Committee. Her mom is our soror, Barbara Boyd, who we're celebrating during this Black History Month for being the first in Cleveland Heights. Our panel, ladies and gentlemen. Frank, are you with us yet? I'm getting text messages that he's trying to log in. Is he there? Not there.
No, I don't see, and I haven't received any new.
Okay, so we will continue. February is Black History Month, and as a way to start off this very important program, we want to talk about experiences of African Americans and health and the healthcare system historically. Dr. Wright, you are a distinguished researcher. You have studied minority health and enrolled many African Americans in clinical trials. Can you talk to us about some of the things that we hear about, such as the Tuskegee experiment and Henrietta Lacks? What were those experiments? Dr. Wright, you're on mute.
There we
There you go.
Okay. Well, thank you, Ms. Turner. President Rollins, distinguished panel members, and the wonderful, talented ladies of Delta Sigma Theta. First, we'll discuss the Tuskegee study of untreated syphilis in the Negro male. That's the full name of the Tuskegee syphilis study. The study was started in 1932 by the precursor to today's NIH and the CDC. It was conducted at the Tuskegee Institute in Tuskegee, Alabama. Now, most of us know what syphilis is, but simply consider it a sexually transmitted disease because it is so easily treated with a shot of penicillin. However, untreated, and in 1932, it was known as a devastating disease that destroys major organs, bones, and especially blood vessels, causing rupture of blood vessels, rupture of heart valves, dementia, blindness, spinal cord damage, among other complications. In 1932, men were recruited to the study with the initial intent to see if there were differences in the natural history of syphilis between Blacks and whites. It had nothing to do with treatment, though it did include a spinal tap and a consent for autopsy, for which the participants would receive $50 in burial costs. The important thing is that by 1934, it was known from the study that there was no racial difference in how syphilis affects Black and white men. However, the men continued to be followed for another 38 years and not allowed to receive treatment during those 38 years. Importantly, in 1945, penicillin was discovered, and the agencies that funded the syphilis study actually provided rapid treatment centers for syphilis in 1947. In 1964, the Helsinki Declaration Against the Nazi Experiments was released. And it wasn't until the release of the New York Times story in the 1970s that, in fact, the study was stopped. And afterwards, there were congressional hearings, a lawsuit. President Clinton, Bill Clinton, issued an apology in 1997. By then, should know that Ernest Hendon, the last survivor of the Tuskegee syphilis study, died at the age of 96 in 2004. In addition to the $50 burial costs, he and his family received $50,000 from the lawsuit that had developed for his 40 years of participation in the study. Important thing about the study is that there was no written protocol for the study. The protocol was essentially made up as they went along. There was never a consent form, and the patient participants were never told that they were not being treated. Participants, in fact, were lied to about their disease and the treatment options available. And in fact, in many instances, the investigators and government agencies acted to prevent them from getting treated outside the study. So that was the Tuskegee syphilis study. The story with Henrietta Lacks, she was a Black woman who lived in Baltimore and died of cancer in 1951. She received her care at Johns Hopkins Medical Center. During her treatment for cancer, tissue was removed and provided to researchers at the university. One of the faculty members, Dr. George Gay. The scientists discovered that the cells from her cervical cancer, which was later found to be misdiagnosed, it was actually adenocarcinoma, were found to survive and reproduce in tissue culture essentially indefinitely, even though other cell lines that were available at the time lasted only a few days. And because of their durability, these cells, which were named HeLa cells, were used in experiments all over the world. Because the cells were so long lasting, many experiments could be done and the results compared with other experiments, making them critical components of research studies of many diseases, including cancer, in addition to cancer, but also AIDS, the toxic effects of drugs, the toxic effects of the various toxins around, and even Jonas Salk used them to develop the polio vaccine. More than 11,000 patents were made based upon the use of these HeLa cells, making their commercial worth essentially immeasurable. Actually, personal story, in the 1970s, when I was in graduate school, I used HeLa cells for my PhD research. And I never learned until I was gifted the book, The Immortal Life. I never knew where the cells came from. Despite the huge benefit to medical research, the commercial value based on the research using her cells, Henrietta Lacks was born and died in poverty and buried in an unmarked grave. Neither she nor her family were told how her cells were being used, and found out only by chance that they were in fact being used and how valuable they were. She was never asked to provide permission for the use of her cells, and neither she nor her family received compensation even to this day.
Dr. Wright, I want to thank you so much for that, and my sincerest apologies for the delay and technical issues on my end. What I wanted to ask you in regards to what you were just sharing, have there been any changes in how research is conducted that will prevent these things from happening today? Because I recently checked out a book, Medical Apartheid, this thick, right? And so it's filled with several similar stories, which justifies the level of distrust among the folks in our community.
Yeah, let me answer the question this way. First of all, as I've spent my entire career, 40 years of academic life, has been focused on obtaining desperately needed data on the best way to prevent and manage diseases that affect Black patients. The only way to obtain those data is for Black patients to volunteer to participate in those research studies. For example, it took 10 years after the introduction of 2 blood pressure medications before we had the studies to determine that 2 major classes of blood pressure medications were less effective in treating Black patients, Black hypertensive, were less effective at lowering blood pressure in Black patients. Other studies, which I was the leader of, showed that the 2 other blood pressure lowering drugs were less effective in preventing cardiovascular disease in Black hypertensives. The data on the availability of the major drug to treat renal disease, of which is epidemic in Black patients, was not available until 10 years after they were shown to be effective in white patients with kidney disease. During the AIDS epidemic, the only effective treatment for AIDS was to participants who were participating in research protocol. Those who were not in research studies died without being treated. So what I'll end with is that the Tuskegee syphilis study was 90 years ago. Henrietta Lacks' story was 70 years ago. We are now in 2021 Cleveland. This is not 1932 Tuskegee, Alabama, or 1950s Baltimore. We have many more safeguards in place to protect research studies now than then. And these, but I think more to the topic of this session, when we speak of the COVID vaccine, we're not talking about research. You take the two vaccines available from Pfizer and Moderna, for example. Most vaccines studied are studied in between 3,000 and 6,000 patients before being released. The Pfizer vaccine was studied in 44,000 patients, and the Moderna vaccine in over 30,000 patients, each of which had 10% Black patients. So we have the results and know their effectiveness in us. Moreover, now there are 35 million Americans who have received the vaccine. So there is little that we don't know about their effectiveness and safety. So when we stick our arms out for the vaccine, we're not doing so as research patients. So we are not research subjects. So I think we have to put, certainly there are still, we have to be careful, and there are ways in when usually give talks on ways in which Black patients can protect themselves while they're participating in research studies. That's a topic of another discussion. But don't want to discourage Black patients from participating in research studies because it's necessary, and that's the only way in which we're going to, again, begin to get rid of the huge disparity in outcomes between in us compared to other populations.
The truth with context definitely makes all the difference, and I appreciate that right there. And Dr. Melliner, this is work that you've engaged in daily, so can you tell us what exactly is COVID-19, and what is the COVID-19 vaccine? Are there any known side effects, or is it just too soon to know?
Right, so there's a lot that we do know. So COVID-19 in and of itself is one of a family of coronaviruses. Now, people might think the coronavirus in itself is new. That family of viruses has been around for years. It was first discovered around 1965. And from a minimal standpoint, a coronavirus can cause the common cold. So it's not a virus that's new. What's new about it is how it's transmitted now. Initially, some coronaviruses are spread among animals. When the SARS came out back in the early 2000s, that was a different virus, but also in the same family of viruses. We fast forward to 2019. As you know, some of the history started in the Wuhan market in China. Initially, they thought that bats may have spread the virus. They thought other animals that were being sold in the market were spreading the virus. And then as the virus spread, we found out that it was being spread among humans, not just from animals. So at some point, it is clear that the virus jumped from animal transmission to human transmission. We're just not exactly sure which animal is responsible for that jump. As the disease spread worldwide, we were able to learn a lot. I would be remiss if I didn't thank the committee and thank Frank and my fellow co-panelists, and echoing the sentiments that Dr. Wright so eloquently put forth is that we are no longer experimentees. The vaccine was developed in the same scrutiny that all of our vaccines have, whether it was tetanus or smallpox or measles or rubella. It just seems like it was faster, but the science and the data were always there. The only difference is we were able to cut out a lot of the red tape in the development of this vaccine. So the things that we can tell you about the vaccine is this is not a live vaccine. So there is no live virus in the COVID vaccine. The two that are present now use a small piece of what we call messenger RNA. It's a signal to your body's immune system to mount a response against a foreign invader. I think that's the simplest way to look at it. It does not contain genetic material. It will not affect your genetic material. The virus, once it gets in your system, what our immune system tries to do is fight it off. So vaccines are developed to fight off infection. They have been tested, they're safe, they're efficacious. There are common side effects that we expect from vaccines. It does not mean that you get the infection from getting the vaccination, and we want to stress that. So minor side effects are just that. So some people will experience soreness in the area of the injection. You may feel fatigue or tired or body aches. These are all signs that your body is starting the immune response. It does not mean that you have infection. And there are a few reasons that you don't get a vaccination. The biggest one would be an allergy to any vaccination in the past, and that's a severe allergy. So that's not like you're allergic to penicillin or you're allergic to fish. It's a different kind of allergy. So an anaphylactic reaction is the long word for a severe allergy. And that's if you've had your eyes swell up or your throat close up or your heart beat too fast, you've had to get to an emergency department or carry an EpiPen. That would be a reason not to get the COVID vaccine, or if you're allergic to any of the components. Basically, the components in the vaccine, besides that small virus particle, and not a virus particle, but a protein that triggers your immune system. And the other are the three major food groups. It's salt, sugar, and a fat-soluble molecule that allows the vaccination to stay stable until it gets in your system. We encourage you, though, if you're concerned that you may have a reaction, or if you're concerned that you should not get the vaccine, please have a conversation with your healthcare provider to discuss that. We do know that the hesitancy is real, really for the same reasons that Dr. Wright mentioned. We don't want to feel like we're being guinea pigs. We don't want to feel like we're being tested on. We're still distrustful of the system. We want to make sure that the information you get is accurate, it's up to date. And thank you, Soror Rollins, for stating that material changes very fast, our knowledge changes very fast, but we do our best to stay up to date on the most recent information. And at the end of the day, what we're trying to do is prevent the spread of COVID and the complications from COVID for not just the young and the old, but our most vulnerable population, so we can get back to doing the things that we really missed most during the pandemic. And thank you for having me on the meeting. Thank you.
Absolutely. I can't thank you enough for emphasizing that doctors are doing their best collectively regarding this situation. I know what I've seen from the interviews I've conducted and from the stories that I've read in my shows. So I kind of have an idea of the answer to this question, but since you are the expert there, Dr. Milner, what are you seeing when it comes to this virus with us, with African Americans?
So I can tell you that we are disproportionately affected. As a rule, we are a population that, for the most part, doesn't always take the best care of our health. So people with underlying conditions that are already sick and tired, right? Once you get COVID, it's not a good combination. So not only do we get COVID in larger numbers, our diseases make our COVID illness and infection much more significant. So the people that are taking up the ICU beds and are winding up on ventilators, and heaven forbid, having passed away from COVID, are people that aren't in the best of health to begin with. We know that getting a vaccination, while for the most part, we know they're 94 to 95% infection, so that means they're effective. That means there's a small subset of the population that won't be as protected from the vaccination. But that also means that if you get COVID, your infection is much less severe, less likely to be to the long-term complications that we worry about, and the more significant complications. What we're trying to do is keep people healthy. We're trying to keep you out of the ICU where your family can't visit you. I think everyone on this call can attest to having been at least not personally affected by COVID, but knowing someone that was significantly affected by COVID. And this is just one way to stop the spread and make it so that we can get back to what we like doing most. It's hard to do. We encourage you, and I do want to put this bug in, when the vaccine gets to you, if you choose to take it, please take that opportunity. As you know, the vaccine rollout has been complicated and fraught with all other kinds of challenges. That's a whole nother conversation we could save for another day. But please, if the advantage is working for you and you've had that conversation and it's right for you, take advantage at that time, because that bus may not come back around because of the supply. But we are working very hard to make sure that everyone that wants a vaccine has access to a vaccine.
I can't speak if I don't unmute, right? Thank you so much for that. I really appreciate that. And Dr. Knighton, you are an infection preventionist, I should say. So you shared with the community many ways to prevent disease transmission. But as people start getting vaccinated, how does that really impact infection prevention strategies that we have in place now and as we move forward?
So don't stop. I can't emphasize that enough. I've seen situations recently where there, like let's say there's been vaccination parties, or where individuals have had an opportunity to be vaccinated, and because they think that they're vaccinated, that automatically makes them think that they're safe. And that's not necessarily all the way true, that they may be protected. So what if they just got that first dose and maybe they're in need of that second dose and they're thinking they're fully protected because they've got the first part of the series? There's also individuals, as this is being rolled out, everyone won't get it at the same time. Everyone won't have access to it. So you're not sure about who has COVID versus who doesn't have COVID. So hand washing, making sure that you physically distance, staying home if you're ill. And when I say hand washing, I'm not talking about, hurry up and throw some water on there in 20 to 25 seconds, but making sure that you're getting in between. That won't work. And people don't know this, but literally only 3 to 5% of people in America wash their hands correctly. And so something that is so simple, if you don't do it correctly, then it didn't happen. And so there's other things that we typically don't think about in our day-to-day when we're sitting down our third hand. So I call our third hand our cell phone. So all of us are guilty about sitting them down on surfaces and then putting them back up to our face or putting them back up to our mask, not realizing the germs that we're transferring. We have the issue of the mask beneath the chin, and many still don't understand that exposure to your neck and then pulling it back up over your mouth means that there's potential droplets or germs that you're transferring right to your face. And so I just emphasize to you that as the vaccines are being rolled out, this is a collective effort. So the vaccines are going to work hand in hand with hand washing and everything else that we're doing. It's not a one or the other type thing. We have to still keep up these practices. This is not the first pathogen, unfortunately, that has affected us, and it won't be the last. So a lot of these practices we have to take on in our day-to-day lives and adopt them in order for us to be a healthier people. And I'm sure some of you already have seen the flu numbers this year, seeing what's happening in terms of illness. We're coming upon a point in time where we realize that it's not just about living to work, but how do we make sure that we're working around our environment as well as illness too, and being conscious of our own illness when we're around others.
I imagine it must burn you up to see folks with that mask around their neck, or even having it on but not covering their nose. That has to be such an irritant, because you see the back end of what happens if people don't adhere to the guidelines.
It does. And I think one of the things that many don't think about is, so there's this thought process with COVID, that when COVID goes through the eyes, mouth, and nose, that, okay, if it's not necessarily down in my respiratory system, then I'm good. However, people can hold it, like let's say right there in their nasal cavity, and when they sneeze it out, or they hold it right in that area and they're talking and then they cough it out. So they literally can still transfer it to someone else and not even realize it. And so there are possibilities in so many ways in which it can transfer, but I think we sometimes get so hung up on the test that if the test doesn't come back, that we may not necessarily be able to transmit it. But I tell everyone, assume that you have it and walk around with the mindset of who depends on me and what depends on me in order for me to make sure that I'm not transferring it to someone else. So if we all kind of walk around like we don't want to get someone else sick, then I think we'll be a lot better off.
Yeah, consideration goes a long way. Thank you so much for that. And I want to turn to State Representative Janine Boyd. I want to thank you as well for being with us this evening to talk about such an important topic that's impacting all of us. We're learning to live with this situation. But can you tell us about the work you're doing with the Health Committee and if the state legislature is involved in the state's vaccination plans, or if there's any additional relief coming to Ohio residents in the middle of this pandemic? I know that's a lot to unpack, so go ahead and give us what you got there.
Well, thank you so much. Thank you, Delta Sigma Theta family, for having me. My mother was ecstatic to know that I would be a guest this evening, and reminded me that I still need to get my Delta on. So thank you for that. I want to, and please forgive me, I have a toddler, as I mentioned, and so I may at any minute bend over and pick him up or chase him. But I wish I could tell you, I wish I could tell you that the business of the Ohio House Committee on Health was the pandemic, that it was the business of working with the governor to get a process that's centralized and organized and reflective of the understanding of everything from racism being a public health crisis to, along with COVID, to the urgency of teaching everything from mask wearing and hand washing to safe distancing and taking advantage of the vaccine if you are in the position of being on a list and getting that call. It is not. We are. I apologize if it's not my baby. Stop, please. If it's not my if it's not appropriate for me to be political, but I'm a Democrat, and I don't know how else to tell you this information except to say that the majority of the Ohio House of Representatives and the state legislature as a whole is majority Republican, and they happen to fall in line with what a lot of us have seen in the previous president's administration, and that was a resistance to centralized and organized efforts. It was a resistance to even complying with science-based information. It was a resistance to, I was in Columbus today for a vote, and the majority of the majority don't wear masks. They do not social distance. Every time now my colleagues and I go down with our now double masks and face shields, hand sanitizer, etc., we are at risk. We're at very large risk ourselves, because we work with people who either don't believe the science or believe that the right to refuse to wear a mask overrides the science. So I wish I could tell you better news. I wish I could tell you that in the Health Committee, so we have not had committee yet. We just adopted our rules for this General Assembly, which were also quite alarming, the rule changes that this new Speaker of the House made, and also very clearly in opposition to policies we've tried to pass from the minority caucus about the pandemic, whether we're talking about relief to Ohioans. I have a paid family and medical emergency leave bill, for instance, that I've introduced since I first arrived 6 years ago and have only had 2 hearings in 6 years. I did an emergency, COVID emergency paid family leave bill that we could have implemented, the governor could have signed, and we could have had assistance that accompanied or supplemented unemployment. And we know how difficult it's been for folks to get their unemployment resolved. So I wish, I can tell you in the last General Assembly that the Health Committee instead entertained a lot other sorts of bills everything from abortion bans and restrictions to I mean, I wish I could, I really wish I could tell you that there's a commitment and a desire by the 64, 65 Republicans out of 99 members of the House to protect Ohioans from this disease. But I have no evidence to present to you that that is the case. It is absolutely our commitment, the 34, 35 of us in the Democratic caucus, because we work for you, we understand that we work for all Ohioans, that it is our commitment to keep pushing. But you know, it'll be events like these. It'll be conversations we have with our family members and our friends. It will be, and our neighbors. It'll be up to us, really, as it's most often been throughout history, right? As we talk about Black history, it's often been up to us to not only advocate and stand for our community and for ourselves individually and our families, but to push for policy that is inclusive, that is equitable, that is fair, that is protective. And we're gonna have to keep pushing. And I don't know how else to say this except to also say what I noticed today in Columbus was, while the presidential election is over, we still have a ghost, and we have some time before us where we're going to have to sort of exercise that ghost. We're going to have to put in the energy to counter the energy that's still there. And until we do that, I think it's going to be more uphill. It's not impossible. This is why we do this work. This is why we are in policy work, but it is an uphill battle. And I'll just end with this. For instance, in the state Senate, you may recall this summer, Senator Sandra Williams, my senator, introduced in the Senate a resolution declaring racism a public health crisis in the state of Ohio. We did a companion bill in the House that never got a hearing, but in the Senate it received 2 hearings, and it was in the Senate Health Committee. Now, what you must know, and you might recall, is that the vice chair of that Senate Health Committee, Senator Huffman, Stephen Huffman, a medical physician himself, asked a most egregious, ignorant, offensive question. He asked if, and I'm paraphrasing, I don't have the word, it's never going away because it was recorded. You know, we live stream our committees now because of Democratic efforts to make that happen.
I'll give you the direct quote. I'll give you the direct quote. And I'm so sorry to interrupt, but I just want to give you the direct quote.
Please.
Could it just be that African Americans or the colored population do not wash their hands as well as other groups, or wear a mask, or do not socially distance themselves?
Thank you so much. Yes. So he asked that question to the African American woman, executive director of the Ohio Minority Health Commission. And she's been doing that work through many governors on both sides of the aisle. They respect her that highly. She has always been there. She's been there as long as my mother was. When my mother was there, she was there. So this brilliant woman, this is who he asked this question to. And what you need to know is, while we have, you know, as the Ohio Legislative Black Caucus, all of us, the Democratic Caucus, we have raised issue with the new Senate president, who happens to be his cousin. That's Matt Huffman, Senator Matt Huffman, about him, you know, remaining on the vice chair on the health committee. He was then promoted to chair. He is now chair of the Senate Health Committee. And understand too, his medical practice actually fired him. They terminated his employment because of those remarks, but the Ohio Senate promoted him in light of those remarks. So this is someone who's going to be in charge. He's going to lead the health committee on vetting policy, whether we're talking healthcare, reimbursement or delivery of services, anything related to the pandemic that may come up, everything. He's going to be leading the committee. So this is where we are. You know, that's why I say to you, I prefaced my entire statement by saying, I wish I could tell you more positive news about the legislature working in concert with the governor and using its best and brightest members who have experience. I mean, we, on the Democratic side, we have a medical physician, and, you know, and while I'm just a speech and language pathologist by trade, I did do direct service delivery in a hospital setting. I understand hand washing. I understand wearing a mask. I understand those things. You know, we have these people who understand public health. Our minority leader comes from public health. That was her, she got her law degree and went right into public health. We have amazing folks, and if we could work in concert, it would be incredible. I think you would see a completely different result, but we do not. Hi, baby, we're coming. But we do not have that, and I wish I could tell you that we did.
Well, I think all of us, I'm seeing the head nods. I think all of us just appreciate the unfiltered truth that you're providing. Two things, Representative, I want you to not feel like you owe an apology, because you just made the point that I was making earlier, that we're learning to live with this virus. And so I understand, I get it. I've got little ones and I understand what it's all about. So you do you, and you're doing it well, because you are providing great information and juggling motherhood at the same time. So we thank you for that. I want to tell the folks out there that we want to open this up for your questions. I'm seeing some of those come across on the chat, and I'm going to do my best to try and get to all of those before we call it a night. But I wanted to ask Dr. Knighton, we talk about what we need to do on the front end, right? When we're talking about washing our hands, wearing our masks properly. But what we haven't really talked about is, and I want to pose this to each of you, the mental agility that you're having to apply to deal with this, because it has to be taxing on you as well. Can you give us some of your thoughts on that? Because it has to be exhausting. You're a human being as well.
So thank you for that. And that's an awesome question, Frank. And if you could just imagine my experience, for one, like I was there for, you know, H1N1, Ebola, Zika. We constantly see healthcare associated infections, community acquired infections. So that realm is not anything new within the hospital walls. The thing is when you're realizing that America was given a crash course overnight in infection prevention, and how connected we are to these individuals that are not just community members, but they're also our patients. These are also our family members. And I'll be honest, it has been mentally taxing. So it's been that thing about me having to put on that lens of saying, I need to share information and I need to get information out there. Individuals don't know how to practice infection prevention in their day-to-day lives. CDC, World Health Organization, our Board of Health are great resources in regards to steps to take. But how do you implement infection prevention in your day-to-day life when this is something that you haven't had to do? When we on the medical side, this is something that we've had to practice for years in order to be able to get down pat to not transfer germs to people. So you have that side. Then I have the side of a Black woman as someone's mother, as someone's aunt, as someone's cousin, and interacting with family members and friends that have fall victim to COVID, either through death or have received ventilator support, have them refuse services. So when we talk about, you know, what Representative Boyd saying with, you know, racism being declared a public health crisis, to be able to see this within our own healthcare system and understanding that there are so many things on so many different levels that need to be corrected. I'll be honest, some days I want to quit, but it's like I understand that I can't, because I know that there are individuals that need us. Because I'm like, oh my gosh, is this really our system that's doing this? When someone maybe didn't receive follow-up care appropriately like they should have, or they're on the verge of dying, but here it is, they really couldn't, you know, they called in to the line, but maybe it was a Caucasian or white, you know, white person that was on the other end and said, oh no, stay home. And then the next thing you know, that they're having, you know, detrimental consequences as a result of their health. we can talk about this equity situation on multiple regards, you know, whether it's directly within healthcare, whether it's outside of healthcare. The fact that right now we know individuals want to be vaccinated and they want to do it for their own protection, but guess what? Their employer may not give them that time off, or they may not have that sick leave, you know, saved up, or there's no policies in place for that. So I'm not necessarily dealing with a situation of just vaccine hesitancy as much as it is individuals that are having to decide between whether or not they're going to play risk or reward with their health care, with their jobs, you know, with their families. They're having to make these decisions, and unfortunately, we are part of a system that doesn't support us, even though we are the ones that are being gravely affected. So having to parse that out every single day, I celebrate my small wins and the things that I can do. So when I am talking to somebody, whether it's, hey, make sure you're taking care of yourself, you know, and eating how you're supposed to eat, making sure that you're cleaning your hands. If I am out in public and I see somebody doing something incorrectly, I will politely just kind of tell them, like, look, this can put you at risk or put others at risk, and let me tell you how. And I may not have that time all the time, but at least try to do it, and that's like my small win for the day. So, you know, it is. I will be honest, it is taxing. And then on top of that, you know, we have that topple with conspiracy theories and, you know, so much other stuff. Like, oh my gosh, my inbox is constantly jumping. And I just tell people, like, look, my job is not to conform to your views, it's to help you to understand the science that's around it. So you're right. I appreciate you for asking that. It is very exhausting. We are managing it. I'm sure that there are a lot of us that are hearing it. And I'm sure even, you know, Dr. Milner and Dr. Wright can speak to this as well, that even being on the healthcare side sometimes, but being a Black person, sometimes it's our own that attack us when we're sharing the best science, because they're thinking that we're working on the other side with the white people. And this is just the bad news that we also have to deliver and be a part of. So it's a conundrum being stuck in those places of where we fit to try to fix it. But, you know, it happens.
So bottom line, it's a lot.
It is.
It's a lot. And that just kind of speaks to how pernicious this situation is. I want to know, Dr. Knight, what's the look you give folks out in public when you're calling them out? Give us a look.
I'm not even mean about it. Like, I'm really not. I actually walk up to him and I'll be like, listen, let me tell you about that mask. Like, I'll have a for real, like, just an everyday conversation with them. And I'll say, so look, I said, you see how we're talking to each other? I'm like, if I got COVID and droplets travel through my mask onto your neck and you pull it down and pull it back up, you now have my droplets in your mouth. So I actually talk to them just like that. And it's just like that aha moment of where they get it. You know, so I just think we got to do it one person at a time. And I think that, yes, tests matter, but I think that's where our government got it wrong. It's so much emphasis on tests that you're not telling people what they can do individually to stay safe. And I think that goes a farther way than telling someone, oh, by the time you go get the test, we're trying to see if you have it or not. But what about the ways to just not get it? Understanding that we still don't know how many long-term consequences are associated with it. So it's got to be about prevention. And my motto is prevention is better than treatment.
Absolutely. And, you know, here's a question I want to throw out to Dr. Wright, because this is from one of our listeners. The question is, has there been research around pregnant women and the vaccination, or a breastfeeding woman and the vaccination?
Yeah. I'm trying to remember the research. There have been studies going on regarding the use of vaccines in pregnancy and in nursing, but I have not seen the results. I don't know, Lynn, have you seen any of those results? Because I have not seen them.
No, I have not. What we can tell you is that there's limited data showing that a woman that's pregnant and infected with COVID, we do not believe that the infection crosses the placenta.
Right.
I think there's been some recent limited data that came out this week that said, in fact, if a woman is pregnant and has COVID, she may get a little bit of immunity passed to the baby. We are recommending, though, that if you are pregnant or you're lactating, that you do get the vaccine.
Yeah.
Obviously, talk to your healthcare provider, because some people will feel like that they need more information about that. And I do believe, like, when they do COVID studies or vaccine studies, by the time they get to phase 4 of a study, that's when you try to ask questions about how this vaccine occurs or how a disease occurs in specialized populations. So that might be, does it act differently in diabetic patients? Does it act differently in pregnant patients? And the fact that the vaccine is so new, some of that research is going and ongoing now, but a lot of the data is really limited. But we'd still encourage them to get vaccinated if they're pregnant, thinking about becoming pregnant, even if they're breastfeeding, because that prevents you from getting COVID on top of being pregnant and lactating. And it's a much better situation to avoid getting COVID entirely than to be concerned with what may happen with the vaccine.
Yeah, and
Dr.
we do
Milner,
know.
Frank?
I'm sorry, go ahead.
Yeah.
Go ahead, Dr. Wright.
Yeah, we do know that pregnancy and COVID is
Not a good mix.
not a good mix. So, it'd be a shame to deliver a baby and then not be able to take care of it.
Also, too, Frank, the one thing that I do want to tell readers is, like, so there are a lot of different organizations, and I'm talking about healthcare organizations with professionals that specialize in these particular areas. So you have the American Obstetrics and Gynecology. So they have statements that they've made pertaining to the COVID vaccine, and they're actually seeking out data as well on that very topic. So for someone that's pregnant, I would recommend them to their site. The American Diabetes Association. So I encourage anyone to think about their chronic condition and seek out the organizations and their statements that they're making about the vaccine, because they have just as much of a vested interest about the chronic conditions, okay? So if it's anything, like lupus, the Lupus Foundation made a statement about theirs, about that they're still doing research in this very area, and that they recommend that you talk to their provider, but they cannot recommend it at this very second. So whatever condition is pertinent to you, go to those websites, check them out, and then that way when you go to your provider, you'll have questions.
Great response there. I want to ask this question, and then I have one more, because I want to make sure that everyone can log out for a little while today. I'm sure you all are all zoomed out. But Dr. Milner, here's one of the questions. If you've had COVID-19, how effective is the vaccine?
The vaccine is very effective. Look at it as like having a disease. When you were a child, for those of us that have had chickenpox, you get chickenpox once, and until you get older, you get shingles later. So you get some immunity actually from having the disease. What we know early on is that immunity from COVID infection is not long lasting or lifelong. So it doesn't mean that once I've had it, I can't get it again. We do know that you can get it again, and now we're concerned about the variants that are starting to crop up. The infection may mutate, but yes, having infection once does not mean you can't get infection again. So you absolutely should get the vaccine, because we can't tell you when that immunity will wear off. We know it's not permanent, and we know that in order to protect yourself and continue to protect yourself, you will need to get to the vaccine. I just want to just echo for a second everything that Sora Knighton said. I have been on Metro's COVID hotline from the very beginning. So we've taken 36,000 calls. I've taken 10,000 of those calls since March of last year when this first started. And I will tell you that as much as we know, people are afraid of two things. They're afraid of getting COVID, and they're afraid of having a bad outcome from COVID. But preventing the spread of COVID, and there are still people that are very much afraid. Understand this. I tell everyone, have a healthy respect for COVID. Even the most careful people can get COVID. You can be as careful as you like. You can be the most careful driver. If the person next to you is distracted, they're going to hit you. COVID doesn't take much to take advantage of your chin diaper. It doesn't take much to take advantage of your friend that came in from out of town, and oh, guess what? When they got back out of town, told you they were positive for COVID. When you're sick, you stay home, and she's absolutely right. People have to choose between, do I go to work sick because I need this job? And if I don't go to work, I can't get paid. I can't take care of my family. So these challenges are very real. And a year later, some things have changed, but a lot of things haven't. I was on a call once and somebody said, well, maybe we just need to scare people. If we're not scared now, a year into this, I don't know what it's going to take for us to turn around and be scared. But it's a marathon. It's not a sprint. Nobody ever predicted that a year later we'd still be having the same conversations, giving the same advice. And at the end of the day, we've always said mask, distance, and wash your hands. Those are some of the things you can do. It's free, it's easy, and we got to stop this spread. We do.
Have you found yourself afraid, doctor?
I'm very much afraid that people sometimes just can't do the right thing. So back in July when we had the surge, right, and then we had another surge in October, what did we say? We said stay home, but people can't stop going to barbecues. We can't stop having bingo. We lose loved ones, and we can't stop having homegoing services because we want to say goodbye. We are social people, and I'm very afraid that it's hard to not be, right? Unless you personally have consequences or your family members have consequences. I'm very afraid. I'm positive, and I've seen hope that we're getting a little better. Our numbers are going down, but we still have outbreaks. We still have spread. And I'm afraid of what it would take for people to change their behavior. And Sora Boy is absolutely right. I am equally horrified that people say wearing a mask is my constitutional right to wear it or not wear it. If we had the right science from the beginning, if we had the right leadership from the beginning, so much of this would have been different. Testing would have been different. Vaccination rollout would have been different. Having a healthy respect for the virus would have been different. You treat it like it's a joke, then the people that follow you treat it like it's a joke. And the rest of us, the most vulnerable of us, are left to pick up the pieces. And that's absolutely not acceptable in a country that's supposed to have world-class healthcare, in a city that's supposed to have world-class healthcare. We're far from where we should be, and a lot of this started from the very beginning.
Absolutely. Go ahead.
I can tell you my biggest fear and my biggest concern is that you have someone, a loved one, who is scheduled to get their vaccination, and the next day and the day before they become positive. I mean, that's what we're dealing with. You know, we're very close to, in fact, having the vaccine to prevent this disease. And in the meantime, until we actually have that second shot in our arm, then we've got to protect ourselves. So that I am very, I have no qualms about telling someone, you know, you can wear a mask, but you can't, I mean, you cannot wear a mask, but you can't not come near me without a mask. The mask that you wear is not, provides a lot less protection to yourself. It doesn't protect, doesn't protect you as much as it protects those around you. And so that, you know, I've come to even carrying a bottle of Lysol spray or Clorox bleach, and we'll spray so that if someone comes close, there is you have to be very aggressive in protecting yourself.
Yes, you do.
And we have to be very aggressive in getting that shot. I mean, I still remember also that we know people who have, well, we all know people who have had COVID and survived. And some people take that to mean that if I get it, then you know, the consequences may not be so severe. And I hope we don't have that on this Zoom meeting, because they are the lucky ones. 25, I mean, in patients who get it, I mean, it's only 1% die from the COVID if you get it. But there is, we now have data that from China, that 70% of the patients who had COVID are still having symptoms 6 months later. We still, in the US, we're talking about between 40 and 50% of patients who have had COVID are still experiencing symptoms 6 months later. We have medical centers that are now developing specialty centers to take care of patients who are COVID survivors. So that just because you don't die from the disease, it does not mean that you are out of the woods. This is a serious disease and it needs to be taken seriously. And so that there's no time for COVID resistance. Should not have fear. You're much more likely to, you're at much higher risk of dying of COVID than you are of having a major symptom from the vaccine. I mean, in fact, you're talking about 1,000 times more likely to have to die from the disease than you are to have the most serious complication from the vaccine. I mean, the major complication of the vaccine is a severe allergic reaction, which we see every day in our clinics. It's treatable. No one has died from those from an allergic reaction to the vaccine. But with Moderna, you talk about 2 cases per million of the most serious reaction to the vaccine. You're talking about 1,200 cases or 1,200 hospitalizations is your risk. 500 times more likely to have hospitalization from COVID than you are to have a reaction to the vaccine. You're talking about 500 times more likely to die from COVID than you are to have a reaction from the vaccine. So keep that in mind.
Dr. Wright, do you believe that maybe this is not simply folks being skeptical of science, but perhaps the culmination of African Americans being skeptical of the system as a whole, not just simply science, but what many people have reported to see with the criminal justice system, what they see in their day-to-day lives. And so when they have a situation to deal with, such as this, regardless of how the numbers continue to climb, how many people we've had to say goodbye to, they're still skeptical of the people in positions of authority who say, yes, it's safe to trust me, because maybe on the ride home, they endured a pretextual police stop or something of that nature. So it's not necessarily a distrust of science, but a distrust of everything they're immersed in.
Yeah, well, to be honest, I think it's a combination, and everyone has their own reason that they can give you for the reason that they are not doing what they know that they should. But I think the key, though, is, and we've been hearing so many messages out there, and there's so many different messages out there, so that and so little data up until recently, and those data we're not getting out there. So the hope is that as we begin to have people within the White House leadership who know what they're doing. I know these people who are serving on these the advisory panel and in these positions who are battling COVID. These are brilliant people, and so that and they're also very dedicated and used to dealing with the communities. And so that I think hopefully by the time we begin to get the common rational messages out there, that people will begin to appreciate that, in fact, that what we've been trying to do and provide as scientists may begin to actually take hold compared to what's on Newsmax.
Thank you for that.
Frank,
Yes.
Frank, just really quick, I just want to tag on to that really quick. So I do agree with what you're saying in that it does go beyond health. Like if you think about it, technically from the beginning, people being denied care, being told not to go to hospitals. Then there's the thing about which people, certain ethnic groups having access to a ventilator versus those that don't. So there's the care conundrum in terms of that. You also look at the unemployment rate, you know, which us having the highest unemployment rate, that also means that we have no health care. We're more likely to not have any medical provider or primary care provider to be able to tend to. Even when I'm looking outside of healthcare, and you think about the PPP, let's look at who got rich this pandemic and look at who was left to kind of pick up the crumbs afterwards. So the question that our people have is, we couldn't trust you to make sure we can get in to get adequate care, to get into a facility. So I couldn't even call and get an ambulance. I couldn't, when I was there, I couldn't even get a ventilator if I needed it. I couldn't get good follow-up care. I couldn't get, you know, funding when it came to supporting my business. You shut me down, but I couldn't get funding. But now you want to offer me a vaccine. And so I have to help, you know, my colleagues understand that when we're talking about vaccine hesitancy, it doesn't just come down to just people saying, I'm declining because I just don't want to take it. We're dealing with equity here. So there are certain areas, even right now around the United States, where, yes, Black people are not getting it, and we have no legislation in place to make sure that X amount of percentage of minorities get these vaccines. So if we send X amount of vaccines to your state, this is how many have to be given to minorities. And the lack of that legislation that we have across the board, I'm talking about across the United States, still means that if the vaccine is available, and like one of our guests alluded to, only 5% has gotten it at most, it doesn't just come down to hesitancy, it also comes down to access. I am hoping that whether it's Johnson & Johnson and some of these one-dose vaccines come out, that maybe that'll ease the pain of them being able to just get one dose opposed to having to go back and do 1 and 2. I'm hoping that there will be some legislation in place that will put us at the forefront. I mean, they've declared it as being a public health crisis. They're saying that we're the most affected. So why is it that these gatekeepers, when it comes to our finances, when it comes to access to health care, these barriers are not being pulled down in order for us to be able to get it? And so I think oftentimes we're stuck on thinking people just don't want it. But we are a complicated people in that we have been bogged down by a system that has not been fair to us. And so I think when we get our leaders to start having those conversations, then I think we can really get somewhere.
Yeah, oh, go ahead, I'm sorry.
May I?
Oh, please, yeah. It's funny because I'm looking around the room like,
I know, it's so
the colored square?
I can't agree more. I would tell you, and I apologize, I don't remember, because I'm listening for, you know, falls or something.
We're going to call those people on you. We are all witnessing.
I don't remember who said it. I think it was Dr. Wright. Certainly, we now have a national administration, a federal administration that gets it. And I believe that will, I mean, one of the questions we asked the governor already, the Ohio Legislative Black Caucus, in our conversation with him was, have you spoken to President and President Biden and Vice President Harris about their plans to help coordinate better what has been really a disaster, and in terms of help from the feds in this process? And he said he had already spoken to them. They reached out to him. He was very clear, because we know better. So, and let me also tell you that, you know, this, I don't know how many of you have followed the governor's press conferences since last March, but I have had to watch them, as I've watched at least 90% of them, and because we typically have meetings around those conferences. And one of the, I'll never forget, ever forget, I want to say it was midsummer, maybe late summer, the particular press conference in which a member of the press, it might have been AP or it may have been Dispatch, but one of them asked, Governor, are you concerned that the president will use, you know, the former president enacted some wartime policy in order to confiscate states' PPE that they had purchased and was being shipped to their state? okay? Certain states, not all of them. And I'll never forget that, and for all those who aren't, you know, really into politics, and I get it, but let me give you a little, just let me preface by what I'm about to end of my story with this. Mike DeWine, the governor of the state of Ohio, has served as a state legislator. He served with my mother back in the 90s, early 90s. He has served in the United States Senate, you know, and he served as the Ohio Attorney General. And now he's governor. Now nobody knows the Republican Party better than Mike DeWine. He is a ordained leader, old school, ordained leader in the Republican Party. He is respected, adored, him, his wife, all that. He got more grandchildren than anybody I know. Everybody knows them. They all had a role in his inauguration. You know, Bernie Kosar was sitting up there with Senator Portman at the inauguration. I'm telling you, this is deep. Everybody loved Mike DeWine, okay, in the Republican Party. I will never forget the press conference in which the member of the press asked Governor DeWine, are you concerned that the President Trump, will send authorities to confiscate the PPE that Ohio has purchased? And Governor DeWine said very clearly, yes, of course, we are concerned. And when we followed up to find out if our PPE got, if our PPE had been confiscated, and this must have been mid-summer, early summer, nobody would tell us. So I still don't know. I don't have an answer. I don't know if any of my colleagues do. I don't think so, because we talked about it several times after that. But that was happening, so a lot of so certainly there are these systems that we have addressed, and I also want to clarify, Ohio has not declared Ohio has not as a state declared racism as a public health crisis. Democrats have introduced legislation to declare it a public health crisis. The Republicans have only given us 2 hearings in the Senate and none in the House. Of course, we will reintroduce it, this General Assembly, but it has not been accepted. The governor, we did get the governor to understand, and he did say it in a press conference, that he believes, he understands now that racism is a public health crisis. He did say it in one of his press conferences. That took several conversations, but he did say it. But we will have to really advocate at the federal level, I think, going forward, to ensure that they hold states accountable for equity in terms of the continuation of rollouts of PPE and vaccinations or vaccines and the vaccine. We are going to really have to, the federal government, I think, is going to have to be creative, and they're going to have to hold states accountable. There may be some incentivizing they can do through policy, but I think accountability will be a tool they'll have to use. So I just wanted to add that. Thank you.
We appreciate that. So equity, just give us the tools so that we can be equal, right? We can have some equality. I want to give a shout out to my my friend and colleague, Mr. Leon Bibb there. I see you in the room, Mr. Bibb. Thank you so much for hanging with us. And also, Dr. Tamika Taylor. Hi there. I see you hanging out with us. Thanks so much to everyone out there for attending our esteemed, and we want to thank our esteemed panelists as well. A lot of thought out answers, a lot of experiences. My goodness, did you say, Dr. Milner, what was it, 10,000 calls you've taken? That's unfathomable. But when you look at the amount of people,
they say it's not the years, it's the mileage.
Oh, that's a lot of mileage.
That's a lot of mileage.
Yes, and we want to encourage you all to, of course, speak with your healthcare provider to help make an informed decision about your own care. And Dr. Knighton, we are going to close with you. And, we've talked about our history at great length and for good reason, and how some things have changed to benefit all of us. Can you share with us a tip for how we can embrace our right to be involved in our own care and engage in communication with a healthcare provider? Get us right.
So I'm going to close it up really quickly. I won't give a long-winded answer. So I would first and foremost say, if you do not have a primary care provider, it is so important that you not only just seek out one, but you build a relationship with one. As we alluded to, whether it's COVID-19 or not, you know, Dr. Wright and Dr. Milner talked a little bit about the long-term effects, whether that's being clots, whether that's possible kidney damage, whether it's possible heart damage. These are all systems, you know, that when you go for your annual physical, you can catch some of these issues. And if you can catch some of these issues early enough, then you can have some sort of intervention to be able to correct them or be able to receive information for you to be healthier. So if you have had COVID, if you haven't had COVID, it is important for you to seek out a primary. If you had COVID and you feel like only got a little bit sick from it and you recovered, it is still important that you have a primary. We don't know what we don't know at this very moment in regards to the long-term consequences. It can be 10, 15 years from now and you wondering why you having some sort of shoulder ache. And I know that that sounds minor, but it can be something like that, and it can be associated with the long-term effects of COVID. So it is very important that you do so. If you find that your issues are not being addressed by your primary care provider, which means that if you are feeling off, if something just doesn't feel right, and you feel like you are being dismissed, which tends to happen a lot in the African-American community, your healthcare insurance or your state insurance, any kind of insurance you have, that is your right to take your insurance somewhere to another provider that will listen to you, that will meet your needs. So it is important that you do not feel stuck with one provider. It is important that you also realize you are the CEO of your health. The minute that you put your health in the hands of the healthcare system and you expect for them to take care of you fully when you know your body, that is where you have failed. It is a teamed approach. We help our patients to best take care of themselves so that way they can live their best lives. So I encourage you, find someone that you absolutely adore, trust, or is going to give you honest answers that you can be honest with, because if you do not have that relationship, then you've already failed your health. And I also just want to give a tidbit. Some of you may have seen these already in the community. We are still doing door drops of these. These are COVID infographics, just sharing information about how people can stay safe. So we're still doing porch drops with those. So if you do see them, then they do provide helpful information, as well as our sorority also makes sure that we put up helpful information as well. So again, continue to take care of yourselves, get a primary, and also practice lifestyle habits. So I know a lot of people are concerned about this vaccine, but the way they're concerned about these ingredients in the vaccine, realize that the meat on your plate is probably on a better diet than what you are. So it is important that you stop paying attention to the things that may make you fearful and the things that can actually help you out and save you.
If somebody's not right, I'm gonna tell them I'm talking to Dr. Knighton about it. That's all. Thank you. Well, I think that concludes our session. Thank you so much for everyone joining in on this conversation. These conversations need to continue. Please keep having them and reach out to the experts. They will get you straight.
Bye.
Everyone stay safe and well.
Thank you, panelists. Thank you so much for joining us and providing the information.
Thank you.